Okay, good afternoon, everyone, and welcome to our final overview of the Seminole State Wellness Program called Rally for Health. I'm Denise Wall. I'm the manager of employee benefits, and I'm here to introduce our speakers for today. But before I do that, I just want to cover some housekeeping items. Today's session is being live streamed, so our colleagues at the other campuses will be able to participate. I'll have a laptop here. I can take questions if anyone would like to email me questions. If not, I can also take calls and emails after the session. For attending today's session, whether you're in this room here at Sanford Lake Mary or watching from your computer, you are eligible to receive professional development credits. To do that, those of you who have signed into this room will take care of it. But if you're watching from your computer, please email learning-connections@seminolestate.edu to request your PDC credits. We have 3 handouts here at Sanford Lake Mary. The handouts are also posted on our Rally for Health website. But if you haven't picked those up today, please feel free to do that. We have what's called a Make It Meaningful checklist, the wellness program document, which is on the middle of that pamphlet, and the third is our ADA and GINA notice with the rights and disclosures regarding your health information. So we have a lot to get through, and based on our last experience, we're going to definitely hit the ground running early. So without further ado, I'm going to introduce you to our presenter, Tracy Harvin. She is the chair of the Employee Benefits Committee. She'll also be co-presenting with Raynell Fields, which is our program manager with Florida Blue. And as support, we have our benefit consultant from Highland, Kathy Alexa, in the back. So the 4 of us, hopefully, will be able to share with you about the wellness program, which most of you already have engaged with the program, so definitely let us know when you have questions, and Tracy will moderate from here. Thank you.
Okay. Oh, I'm going to stick with the lavalier. The teacher in me wants to walk around, so in addition to being the chair of the employee benefits, I teach at the college as well. So you're going to get a quick overview of the program and how you can customize it to your needs. You're going to hear us talk a lot about the customization features. But what we're going to do is give you, we hope, a baseline of understanding for our wellness program. We're going to explore the activities that you have to choose from. So this is not a one-size-fits-all model, as you're going to quickly see. We're going to show you how to navigate the Quest diagnostic platform. If you've already had your biometrics taken or you've downloaded your physician's fax form, you already know how to do this. If you haven't, you have until the end of the month to get that done to qualify for our 2019 reward, so you'll want to pay attention. We're going to also show you how you can experience the Better You Strides platform. You're going to hear us refer to this thing as Cafe Well, as Better You Strides, and as Rally for Health. The way I describe it is we've got a corporation called Well Talk who designed the Cafe Well, and then Florida Blue became a customer, and they customized that platform and called it Better You Strides. And then Seminole State is a customer of Florida Blue, so we further customized it based on the Employee Benefits Committee's input to have the Rally for Health program. And then on that theme of customization, I just want to emphasize from the beginning that it's not that everyone has to do all of the same activities. This is really about where you are in your health journey and what you need for your wellness program. So you're going to hear a lot about how you can customize it. And then finally, we want to give you some tips for preparing for success. Because the 2019 reward, it's so super easy to earn that if you want to earn it, really everyone should be able to do it with no great barriers. However, the 2020 reward, not that there are barriers, but there are more activities that will be required to get to your 1,000 points. But more on that soon. Our purpose was we needed to figure out a way to incentivize employees to engage in preventative care and be mindful of health and wellness guidelines. Our Board of Trustee members wanted to see a more robust wellness program where all of us are thinking more in ways about how to use our insurance to our benefit, more for preventative care as opposed to intervention care. So I'm not here to tell you what doctors you need to go to. I'm not here to tell you what you need to be thinking about. Those are conversations between you and your doctor. But the key fact here is that we do want employees to use the insurance for those wellness measures. So that way, should anything come up in your health history, you're in constant dialogue with your doctor. For those folks who complete the reward program for every year, you're gonna see $50 added to your paycheck. And we'll talk a little bit more about that when you get to the convocation sessions when we're talking about selecting your benefits for next year. The plan, it was confusing the first time I ran over the details with folks because I kept talking about 2020, 2020, 2020. Because I want to make sure that everyone can easily get to your 1,000 points. And I sort of forgot to say 2019 is super easy. You just need to go get your biometrics. And we're going to let you double count that. So you get your biometrics, you get the 19 reward. Then those biometrics also apply toward your 2020 reward. So you're going to hear me talking about these two things in tandem, because if you go tomorrow to get your biometrics done, you've earned the 19 reward and you've already started the 2020 reward. So why participate? Everyone's going to have their own reasons for doing so. My friend and colleague Ashley said, please, Tracy, tell everyone that most people are already doing these activities. Most of us already go to the doctors once a year. Most of us, because we work in a closed environment, in a campus environment, we get exposed to a lot of germs. Most of us are already getting flu shots. Most of us are already, wearing devices and monitoring our steps. So she said, please, just emphasize to people that for a lot of us, we don't have to change any behavior. We're already doing this. But then my friend Kevin, and I'm not dropping last names on this recording, but my friend Kevin said, so I don't quite do that. I'm a busy, father, and I don't have time to get to the doctor. So this is going to be a little bit harder for me. So depending on what your relationship is with your healthcare provider already, it's going to depend on, is this going to feel easy to you, or is this going to feel like a little bit more work? We're going to try, though, to take you through and show that it is fairly easy. We wanted to move to a personal accountability approach. So you're not going to see a lot of activities that are self-reported. It's really going to be you doing something to get those points. We do want to recognize the uniqueness of an individual situation. So if you look up the makeup of the Employee Benefits Committee, we kind of all brought our personal histories with us when we talked about wellness. So we wanted to make sure that everyone, regardless of their situation, could easily participate in this. We committed HR to do a lot more work. So what you're going to see is, instead of doing the little finger pricks on campus for your blood work, which some of you may have already participated in years past, you're going to start doing those activities at Quest. And HR has committed to offering on-campus, expanding their offering of on-campus flu clinics, vaccination clinics. And then finally, a lot of this programming is about building self-awareness. I know some of us might be tired of the word mindfulness. I mean, it's been everywhere, it's everywhere. But I believe in being mindful of what we're doing. It's part of the reason why I wear my little step tracker, because I can see, okay, I only went 2,000 steps today. Maybe I should do a little bit more. As you start to use the Cafe Well platform, you are going to generate that self-awareness about what you are or aren't doing. So again, that's kind of that personal customization feature. I'm a big fan of always kind of questioning, why am I doing something? Oftentimes we jump into the deep end of the pool and we haven't asked ourselves, well, why am I doing it? Everyone will have a different motivation for participating. And I don't have a problem with folks saying, I'm doing this just because I want $50 a month. If that's your reason, that's an awesome reason. You have $600 on the table. For me, I have an almost 4-year-old, so she's hard to keep up with. So I need to start thinking about my health so I can keep up with her. Other people will want to maintain their health. Other people just like having extra energy. So I think it's important when you feel like you're being asked to do more and more to kind of say, well, what's my why for engaging? The biometric screening, again, a lot of us have this, but we don't call it a biometric screening. We just go to our doctors once a year and they go and they take these measurements and then you get some blood work done. What this is you set your appointment with Quest. They're going to record your height, your weight. They're going to take a blood pressure reading, and then they're going to do fasting blood work. So for our program, we thought a good benchmark would be cholesterol ratios and your blood glucose levels. Please know that all of the information is confidential. You and Quest will have that information. Seminole State does not get that information. For year one, what you have to do is when you get your results, it'll be your responsibility to take that to your doctor. Years going forward, we do want to create a program where we can hopefully give you the option to send that information directly to your doctor. But year one, you'll have to send your results to your doctor if you go this route. Okay, so what do I do for the 2019 reward? It's simple. You set up your Quest Health and Wellness account. You then download the form for physician's results, or you make your appointment, depending on what route you want to take. And then you go complete the screening. That is it. Now, some people have told me, I don't want to do that, Tracy. And I said, okay, you don't have to. This program is completely voluntary. But I tell a lot of folks, you're leaving $600 on the table. So if you're already doing this activity, maybe you already had your blood work done in February, you'll want to download the physician's results form and then have your doctor fill that out. So whatever your philosophy is on health and wellness, don't leave $600 on the table. That's kind of my plea to friends. And for those friends who say, I don't want to do it, you don't have to. It's voluntary. Our timeline is running short for the 2019 reward. It is going to end the end of this month. Some people might say, why didn't we do this presentation sooner? Well, it's hard when you look at all the constituent groups and the fact that we have a lot of folks who take vacation in the summer or they're not on contract in the summer. We waited till September and waited till we got our students here and in the seats. And so you guys are getting the last health and wellness screening, information screening for this year. So please know, if you haven't done your biometrics, they have to be done by September 30th. We have this abbreviated timeline because we needed to get started. We thought it was better, the committee thought it was better to get started for this upcoming year than to delay for a whole 18 months. The 2020 reward, again, there's going to be more activities for you to choose from and complete. So you do have to complete your annual biometric screening. If you've already done this, say you did it in January, again, physician results form, that'll apply for your first 100 points in order to start your road to 1,000. Then you'll choose another set of activities to get you to 900 points. And then again, you're going to have until May 30th of 2019 to earn the reward. That's been confusing to some folks. It's like, why am I doing all of this in 18 in order to qualify for 19? Like, why don't I have till the end? It's because we have to get the information verified that you've earned the reward. And then when you start paying for benefits for the 2019 year, you're also going to have the opportunity to earn your wellness reward, so that'll help offset some of those costs for folks. Kim, you have a question, I can tell.
So we've got the earned reward for 2020 by May 30th of 19.
Yes. So the way for folks who think about fiscal years, you know, from years out, our programs are going to run from July 1 to May 30th. We're going to always have a reset month. We have this, okay, I guess I took it out. Great, I took out a slide. Sorry, Denise, I took out a slide. We have this timeline set where, I don't know how I took this out, I just edited it this morning. I'll pull up a timeline later, and at the end I'll show you the 2020 timeline, because when we're going through activities, you're going to see that different activities will be completed at different times. I'll talk about it in a minute, but I did start editing slides. This is just a sample. Please don't take this to be, this is what you have to do. This is just a sample. It is easy to get to 800 points if you go to your doctor once a year. That caveat is if you go to your doctor once a year. In order to participate in the program, you have to take the biometric screening. Once you do that, you get the 100 points. You will not see any points in your reward dashboard until you do that activity. So maybe you've already started other activities, but you haven't done this, you're not going to see any reward points. If you're in your healthy ranges for your BMI, for your blood pressure, for your cholesterol, and for your glucose, then you're going to earn up to another 400. It's no lie, as I said in other videos, it doesn't matter how much I suck it in, my BMI is my BMI is my BMI. I can't stand up in front of you and say, I made that BMI measure. I did not. So I had to do what was called a reasonable alternative. I participated in a 4-week program that basically reminded me about healthy activities, like, am I getting enough sleep at night? Am I drinking enough water? What's my fruit and vegetable intake? What's my activity intake? So I focused on each one of those chapters one time, once a week. At the end of 4 weeks, I earned my 100 points. And for every one that you may not hit the healthy range as set by the medical industry or medical field, you do have reasonable alternatives. So between these two activities, you're already halfway there at 500 points. If you go to your doctor once a year, your wellness visit, you're at another 100 points. Now you're at 600. If you want to get 100 points for the tobacco-free attestation, you have to do what's called a personal health assessment or personal health inventory. You do these two activities, you're up to 800 points. You only have 200 more points to get for 2020. Now, some of you might participate in our STEP challenge that's currently going on, and if you haven't started that and you want to, you can add it in. You might wait till we offer the one in February. Some of you might participate in the flu shot clinic, which happens in about 2 weeks. In order to get the 100 points for the flu shot, you do have to do it here on campus. A lot of folks have asked why. It has to do with the fact that we don't pull in your claims data from Florida Blue for these measures. So if you want credit, you do it on campus. If for whatever reason you don't want to get a flu shot on campus, that's okay. You can go to your Publix or your Walgreens or your doctor and get it done there, but you're just not going to get the 100 points. If you go to your Make It Meaningful checklist, or can you hold up that sheet for me? Yes, or that sheet there, that's a breakdown of all your available points. I have the Make It Meaningful checklist here. So what we have here, the first 100 points is that's your biometric. Here are all your reasonable alternatives to those healthy standards, and here's your health assessment. So this will get you to the 700 points. Then your wellness visits, if you go to your doctor, that's 100 points. Maybe this is your year to get a colonoscopy, so there's another potential 100 points. I didn't hear that. I don't want to hear that. I'm going to ignore that comment. Maybe you do your flu shot on campus. There's 100 points. Maybe you take advantage of the healthy coaching. There's another 100 points that you could get. Maybe you've been part of our diabetes prevention program. That's 200 points. Now, not everyone's going to qualify. I just had a big birthday. It was the 40th birthday. I'll say that on record. It's not within medical standards right now for me to get a colonoscopy. I'm not going to go get that done. But I still have 2,000 other points that I can earn. So just because, you might not be your year for a mammogram, or you might not, men don't get mammograms as often as what women do. They can, though. Yes, Carol?
I'm not afraid to say I had a colonoscopy. And how do we prove that?
HIPAA.
So for these doctors' visits, because the coding and again, I'm not a medical coder. If you want that, we do offer that degree certification program here, so you could become a medical coder. But for the medical coding, for things like your annual wellness visit, a women's well exam, a mammogram, or a colonoscopy, those are all standard, so they can pull from the claims data, because that's going to be the same medical billing code. But when you go and do something like a flu shot, depending on where you're getting it done, or if you're doing self-pay, that it's not a standard code, is what I understand. Yes. Yes. It'll automatically go into your bucket. But I want to repeat this.
Yes.
Hang on. I'm going to try to maintain the class. I normally just teach to 30, so 52 can be challenging. And you guys are a lively bunch. I love it. 1 second. Let me get to this point, and then I'll call on you. So this is a big point. We didn't want any activities to be self-reported. So for those procedures or for those visits that have standard coding, medical billing coding, Florida Blue can pull that claims data and bring it into the Cafe Well system. So you don't have to do anything. However, if Carol hasn't done her biometric screening, that's not going to pull into the system until she's done her biometric screening. So you have to do that first event, which is the biometric screening, before everything else pulls in. Once you do the biometric screening, you've said, I voluntarily am choosing to participate in this. You've set up your Cafe Well site. The rest of it will pull in. Does that make sense? Just get head nods. The look back is going to be, for the biometric screening, it's going to be October 1st. For well visits, I believe it's going to be January 1st. And then we have those dates inside the Cafe Well system. I can't see name tags, but I put you on hold for a question. Donna.
The annual wellness exam and the well woman exam, they're listed here as two different things. So what's the difference?
Can I
So the
repeat Donna's
difference-
question just for the
Oh,
audience
yes.
that's watching from their computer? Donna's question is, what is the difference between the well woman exam and the animal exam? So some people may choose to have two different providers, like your PCP could do your annual exam, but your OBGYN will do your well woman exam. Or the same person could do both. So depending on how it's coded, those visits would be eligible for 100 points each. We'll have to look into that. We'll take that one offline.
So I have a doctor who, I had my annual exam, and Carol, I'm not shy either.
Okay, I just, for the record on the not shy part, no one is under any obligation to give any health data. And
No health data.
HR wants me to just remind everyone that they are HIPAA compliant and that it's always best to keep your information personal. You're willing to share, so share.
Yeah.
But
So my doctor doesn't believe in colonoscopies if they're not necessary. And I asked him if I could have one last week, not for this reason, but I just thought I needed to be tested. And he said because there's no family history, he gave me a list of 5 things I could do. So of those 5 things, I mean, I got this little box in the mail of things they want from me.
don't tell us that, Sandy, because
Yeah.
I already know what they're going to want, and I don't want to know that.
But anyway, so I'm assuming that that'll be coded and submitted, and will it count for colonoscopy? No, I'm getting a colonoscopy then.
Well, okay.
I like the drugs
So
anyway.
I'm gonna hold off on. Okay, you guys are. I love this. I'm not sure I have enough energy for this audience. So let's take a pause. I'm going to pause on all the questions because I know people are going to have a lot of questions as we keep going. And so I want to make sure we get through content and I can get Raynell her proper time to demo the system so you can see the system. I will say, we do want folks to use the insurance to be sure that you are doing your preventative care. But at the end of the day, it shouldn't be the 1,000 points that are driving people to make these healthcare decisions. It should be a conversation between you and your doctor. So just like 40-year-old doesn't need a colonoscopy right now, someone who has a family history they may be able to get those 1,000 points by their circumstance. But I wouldn't necessarily go, I'm not a medical doctor, I'm not going to advise you on what to do, but I'm going to also say to everyone, this is why you want to be in conversation with your medical doctor to see what's best for you. So let's hold questions, and then I promise I will give time for questions. I just want to keep getting through some slides. You can see some of the other activities that you can choose from. Here's my reward timeline, Kim. Good, I didn't delete it. I didn't think I deleted it, but I put it in a different spot. So looking at all of these different activities, if you look to these 4 weeks, 1 day, it takes a different amount of time for activities to pull through the system. If Cafe Well is going to pull through claims data, that's going to take time to do that. For that reason, the last acceptable date for your 2020 reward for preventative care visits is March 1st. So if you go to see your doctor for your annual well visit March 20th of 2019, there's not going to be time to pull that claims data in for the end of this wellness program. Now that claims data will count towards your 2021 reward, but it's not going to count towards the 2020 reward because it takes time. Your last acceptable date for your biometric screening for your 2020 reward is 4/1. Now, if you're taking your biometric screening for the 2019 reward, you're not going to worry about this date because you will have met it back here in July, August, or September. But if for some reason you've missed this cutoff, then you've got all of this time to make the cutoff for the 2020 reward. Health coaching, again, because that takes time to complete and it takes time to pull into the system for your points, April 1st, 2019. And then for reasonable alternatives, you have to have them done by May 30th, and the last day for wildcards, which we'll talk about in a bit, is March 30th as well. Now, for the wildcards, though, I will say some of the wildcards will take 4 weeks to complete. So you can't start them May 30th and think you're going to get those 100 points. So it is about planning. Do you have any questions on the timeline and end dates? Since I told Kim I was circling back to that. Now you're afraid to ask questions, Carol. So the question is, anything you had before July of 2018 doesn't count. For the 2020 reward, yes. For the 2019 reward, that biometric screening will be the look back. Good question. Donna.
The blood pressure one, you say I have 4 weeks to get it in order, right?
You have 4, so let's say your blood pressure is running high when you go and have your biometric screening happen. And occasionally it does. If you have white coat syndrome, it might run high. You're gonna then be given the option to do your reasonable alternative. I have not taken that well card, so I can't tell you if that's a 4-week program, if that's a 3-week program, but when you sign up for your program,
I did that one, and it is 4 weeks.
Oh, it is 4
Yeah.
weeks.
The hypertension 101? Yes.
Yeah. So that does take 4 weeks.
It does take 4 weeks.
So in which case, for the well cards, you would want to start them before May 1st so you can complete them by the end of the month.
That's what I was gonna say, because I did the biometric after May 1st. And
Yeah.
so I started first of all, I don't have high blood pressure.
That's okay.
But when I went there, I was running late, and when I got there, she took my pressure, and I was 121 over like 82. And they coded me, I didn't get my 100 points. And so, you know, you see, I'm upset about this. So I've never had high blood pressure in my life. So my question is, now that I've started late, I'm not gonna get it, right?
No.
Go in-
Wait, this is,
the doctor when I'm not running late.
okay. Okay, so once it's been recorded as high, it's recorded as high. So you are, in order to get, for 2019, in terms of meeting the reward requirement, you've met it because you went for the appointment. 2019, we're not looking at accumulating the 1,000 points. So now you have until the end of May to complete that reasonable alternative if you want those 100 points. But again, when you look at the sheet or look at the meaningful, Make It Meaningful checklist, there are a lot of other ways that you can get the 100 points. So maybe you opt to do a step challenge instead of that high blood pressure. Again, I'm not a doctor, so I can't tell you whether or not to be worried about 121 over 82. A lot of, and I can't speak to Quest, but a lot of doctors will retake it. So if you're running late to your appointment, you run a little high, they can see in your health records that that's high for you. Oftentimes they'll wait till the end of your appointment when you're done and you got all your good news. They take your pressure and it's down.
Steve.
Well, first you measured me, and she said I was 5'8". I'm 5'11", so I made her do it again and taught her math. Second thing, I sat down and they put the cuff on me. She pumped it up, and I had high blood pressure, and I said, "Do it again." She may have put the thing on too tight, and they can make you have artificially high blood pressure.
True.
So make them do it again. Always.
And also, just to add on to that, if you are someone who, like myself, I've got a very big arm, maybe you're not overweight, maybe you just have a big arm, the size of the cuff that they use also matters. I will say that we are having our first Employee Benefits Committee meeting this coming week on Wednesday, and something that I'm going to advocate for across this next year is for the Employee Benefit Committee to have listening groups so that when stories like this happen, we collect that feedback, we share it both with Florida Blue and with our consultants, so we have a wellness program that works for our population. That's been the big part about the customization. I'm not going to take time during the training to tell you all of the fights that the committee had, but sometimes if you want to go get a coffee, I can tell you like the things we fought over. Blood pressure numbers were one of them that the committee fought over. We had to go with what the industry standard is, which is 120/80. So please know that as there are stories like that, you can share them with the HR representatives. You can share them with members of the Employee Benefits Committee. You don't have to necessarily report numbers or your health situation, but if you had an experience where, you know, Quest missed by 3 inches, that's a pretty big deal. We need to know that, because then we need to think about, well, why are we doing this for our wellness program if we can't get reliable, accurate data? And I'm a big proponent of the shared governance system, and so if something isn't working for employees and colleagues, then we need to evaluate that on that committee. And if it is working, we need to know that too, because we need to know that this is what's making sense for us right now, because it's the Employee Benefits Committee. Benefits are part of our compensation, and so we need to make sure that we're getting what we're working for. Sorry, HR, they didn't pay me to say that, but I'm gonna put that out there. Denise gave you these copies of HIPAA, GINA, and the compliance, so you can read those online. We're going to transition now to how you set up your Quest Health and Wellness account. These PowerPoints are available online. Let me say that again. These PowerPoints are available online. So you could have the PowerPoint up and you could walk screen by screen, because that's all we did. I took screenshots and I added highlights so you could see what you're doing. To do the Quest Health and Wellness, it's different than Quest Diagnostics. It's the same corporation but different division. You go to my.questforhealth.com. They're in yellow. The first time you set up your account, you're going to have a registration key. It's going to be SSC 2018. We were really creative with that registration key. You type that into your registration key and you click Register Now. You can download the terms and conditions, or you can read them on the screen, or you can do what I did and hit accept and continue. That's up to you. Once you do that, you're going to have to confirm your eligibility by putting in your user ID. Now, I'm not going to name names, but there were some of us who had some difficult times with this screen. This little circle here, important. You are entering your birth date a second time. We have already complained about it. We don't understand why they make us do it. I don't want to look at Les and start bad-mouthing computer programmers, but we're going to blame the computer programmers. So for step 1, it says, let's say John Q. Samples. I took his name because that's my sample card. Date of birth is May 23rd, 68. For his user ID, he's going to take the purple digits, which is the numbers from his insurance card. So you're going to need your insurance card when you do this. And then you're going to add your 8-digit birthday to that number to generate a 7-digit ID and enter it here. So many of us entered this and we hit continue because we just read up to down. We ignored the second step. The second step is you have to re-enter your birth date. There is a little date picker there, so you could pick out the date if you want, or you could type it in. But you have to do step 1, which includes the insurance card number, the birth date, and step 2, which is the birth date again, and then click continue. Maybe if you buy Les a coffee, he'll tell you why they programmed it that way. Seminole State did not do this, so please do not blame us. But this has been the one screen that has tripped people up. A lot of folks call HR. Again, this is online. You can have this up while you're doing it and have your instructions side by side. Once you confirm your eligibility, it's going to ask you to populate your information. Some information will pre-populate from your account, and others you'll go through and add in. Fill that out, click Save. Now you've got a choice to make. On this first screen, and I laid on 2 screens so we can kind of move through this, you can either schedule your screening at Quest. This is what I did this year, because if I was talking about the program, I wanted to have the full experience. Or if you want to go to your doctor and have them order the results, you can order your form. I'm going to walk you through the screening first, and then I'll walk you through the order form. The screening, you click it, you then go to step 2, which is a new screen. You put in your zip code. I put in the zip code here for Longwood. You can see there are lots of Quest centers. Your employee benefits committee argued about this to make sure before we said, let's go to Quest, that this was going to be convenient for employees. There's a Quest center. If there's not one next to your house, there are centers very close to all 4 of our college campuses. So you can choose your center that you want to have your appointment at. Yes?
I found it difficult to get an appointment. Like, they must have only blocked out certain amounts. Can you go as a walk-in?
So you cannot go as a walk-in with this. With physician's order forms, you can, but with this, they have to know what the script is. So you have to set up your appointment in order for Quest to have the standard
I
script.
was able to get one, but it took me like a month. Like, I had to push it out a whole month because
So-
there was nowhere to go.
So let me repeat this. So what had happened was it took a really long time to get an appointment. Did you go in August, I'm assuming, maybe?
Yeah, it was the beginning of August, and I just got my appointment for the beginning of September. But I went to all different locations, all different times, and there was just nothing available.
So in terms of the availability, I would book my appointment now. Let me get everyone's attention. If you want to get the reward for 2019, book your appointment today. Like when you leave, set up your account, book your appointment, and that way you have it on the books. I would also say that generally there are some times where a lot of people are trying to get school physicals in, or for whatever reason it's a benefit cycle, and so there will be some times where it's going to be naturally more crowded than other times. If you go and try to get, appointments at the end of December, a lot of people are trying to finish spending up flex accounts and if they've met their deductible, they want to get their medical things done. So December is another time where it tends to be very busy. Some of that we can't control, but again, like I said, I want to advocate for employee listening groups so that way that can be feedback that we consider. This first year will be the toughest in terms of 2019 because we decided to do 3 months, a 3-month window to earn the 2019 reward to get us started. But from this point forward, you're going to have, almost 11 months to get the biometric screening done. So for year 1, yes, there's going to be some bumps. So please make your appointments now so you don't run into that issue. But if you're taking this option, you do have to make an appointment because otherwise Quest won't have our script. There's not a standard for biometric screenings. A lot of people said, are they going to measure my waist? Because at my spouse's place of employment, they measure waist. No, we're not measuring waist circumference. Are they going to take A1C figures? No, that's not part of our screening. So you need to have that appointment so you get the 4 things that are part of our screening. Other questions?
Actually had a problem with the setup of login, and I had to call for them to make an appointment for me. Since
Okay.
they didn't have a day that was good for me, they set me up as a walk-in.
Okay.
So there is an appointment, but not actually like an hour a day, but just a walk-in.
So you called the
So
800
we'll-
number to do that?
Mhm.
Okay, that's good to know. That's great feedback. I like the positive feedback too, so thank you. The date and time you choose for your you've already chose your location on the previous screen. Then it's going to have you choose your date and time, and you're going to hit continue. Now, I got tripped up on this because once you hit continue and you confirm it, they're going to ask you to confirm again. So if you see on this screen location, date and time, review and confirm, those are the 3 steps that it takes to set up the appointment. I nearly missed this 3rd step because I'm like, you really want me to confirm it again? They did. After you have your appointment, here's the information here for this particular person. They went on August 28th at 8:30. Here's just reminders of what you need to do. The advantage to having an appointment is you get to go ahead of all the walk-ins. So like when I went for my appointment, there were 6 of us in the waiting room. I got called in as number 2. So having the appointment is nice. Because this is a screening where you need to be fasting, a lot of people want to do this in the morning because they don't want to go 9 hours throughout the day without food or drink. So they don't want to go for the 3 o'clock appointment. They want to go for the 7 or 8, do it before work appointment. So that might limit some of your availability. But the reality is you get to choose your time. Just make sure that you're drinking water before your appointment, you're taking your meds, and you don't eat or drink anything else but water for 9 to 12 hours before your test. Now, for other folks who go to their physician, and why would you go to your physician? So, for example, my physician likes to test my thyroid. Thyroid is not one of the tests on our biometric screening. If I'm going to my physician, she can do the standard tests that our school wants, our place of employment wants. And in addition to that, she can order other tests so I don't have to go for 2 blood draws. So if you're someone who goes for a lot of annual screenings with blood work, this route might be the better route for you. Now, some physicians may charge you to fill out the form. That's between you and your physician. You do have to download the form, and you have to log in, set up your account. I can't stand in Carol's office and Carol goes, oh, I've already downloaded my form, let me print one off for you. That won't work because I need to have my information so it's coded to my Florida Blue account and Cafe Well account. So make sure that if you're doing the physician's results form, you are logging into your Quest account and you're downloading, printing that, and taking it to your doctor. And again, it reminds you what you need to do. So those are your options for Quest. Once you are finished, you can get your results electronically in 1 to 3 business days. My results were there by that afternoon. You should receive an email confirmation. So whatever email you use to set up your Quest account, that's where that email is going to come. If you don't want it to come to your work email, and I would suggest that you don't, it's your private record, you use your personal email account, put your personal email account in that data when you set up your Quest account, and that's where your results will be, your confirmation email will be emailed. You can also go back to that first screen, the myquestforhealth.com, and log in. I'm going to go backwards just for a second. So instead of going to the green side where we created our account, once you create your account, you're going to create your own username and your own password. You can log in here and find your results as well if you're like me and you're just chomping at the bit to know before they send you that email. The results are also mailed to your home within 2 weeks. Your results are confidential. I do not get them. The benefits committee won't get them. HR does not get them. They are between you and Quest. Again, I wanted my doctor to have mine, so I took my printed results to my annual wellness visit and gave her the results, and then we discussed them. So for this first year, if you want your doctor to have your results, you will have to take your results to them. That's the end of our Quest setup. Is there any pressing questions, or can I kind of move on? 1, 2, 3, I'm going to move on. Please know when I teach, I give students more time than that. But I'm looking at the time going, okay, we need to move. The next part, to set up your Rally for Health Cafe Well account. There's a lot of different ways that you can set up your Cafe Well, but we are wanting you to go through your Florida Blue. So if you've never done this, you're going to have to register on the Florida Blue site. And then once you register, you'll create your user ID and password. I like to look at these things are called explanation of benefits electronically, so I log into this on a regular basis. I encourage everyone to set up an account because when you go through active enrollment later in October, it's a good idea to look at how are you using your insurance? How much are you spending? If you're insuring children, you can do analysis to figure out what's the right plan for you. Are you over-insuring? Maybe you want a different plan based on your utilization. So we want everyone to set up their Cafe Well through the Florida Blue account. Once you log into your Florida Blue, there's all sorts of cool data that you can use for your open enrollments decisions. But for our purposes here on health and wellness, you're going to go here to better use strides and go getting started. I'm going to go through this. I'm just going to click through these screens because I want to give Raynell enough time to show you how the system works, and she's going to walk you through. Now, when you do this on your own, though, these PowerPoint slides are already up on our Human Resources website, so you can go through them and do it again, side by side, step-by-step instructions as you go. I want to stop quickly on something called Well programs. Well programs, we also refer to them as Well cards. Raynell is going to show us how to get those added to our account. There are blue cards that only will take a few days and you get 25 points. You can do up to 4. There are other cards, the orange cards, that you get 50 points, but those, and you can do up to 4 for 200, but again, those take more time. Because they take more time, the committee decided they should be worth more points. There are other Well cards that are white that you may do it because you're interested in something like preventive health programs or Raynell is going to show you the personal health assessment, and that's a white card that you would fill out. In that case, you would get 100 points because it's the personal health assessment. But for well cards and well programs, this is what we're talking about. They are little webinars that you customize to your well experience. So if you're someone who's high stress, you might do things on mindfulness and yoga and calming down. If you're someone who doesn't eat so many vegetables, you might want to do the eat your greens. Or if you're someone who doesn't hydrate enough, you might want to do the ones where you're tracking your water intake. So this is how we customize this. Again, right now I'm going to give her more time this time, so you'll get to see the live demo of these cards. The personal health assessment, the committee did not require this, although Florida Blue strongly encourages you to complete it. You get 100 points for completing it. It's the only place that you can attest to being tobacco-free. So if you want the 100 points for the tobacco-free, you have to do the personal health assessment. There were folks on the committee who felt like we should be given the choice if we want to answer all of these questions. If you already have attended a wellness program in the past and you remember those bubble sheets, this is like the electronic version of the bubble sheet. So you're putting in your health, you'd put in your height, you'd put in your weight, your BMI, your blood pressure, and it's a place where you can track your data yourself. Here's the sample for the start, so you can see what you need to do to get started. Once you go through those questions, it'll give you a report. So, you look at, well, what is this person's heart health? And this particular person is getting kind of a caution. So they didn't doing well. I mean, they're sitting at 67. For a lot of us, we would go, isn't that close enough? But it's being cautious. For diabetes, 57. Cancer is 70. Mental health down here is 70. This particular person, maybe they need to get a little bit more fitness in their life. So the health assessment is meant to be kind of that personal wake-up call to say, okay, maybe I want to go and do some well cards on fitness. Maybe I don't need to de-stress, depending on who this person happens to be. So that's the health assessment. It's your choice, but I would strongly encourage that you do it. Raynell is going to walk us through the dashboard so you can see kind of your history of what you're doing in the program. The last section that I'm going to do is planning for success. Now, I will confess to you, I've been logging in like a crazy woman to see my 2020 reward, because as soon as this 100 points posts, this last 100 points, I'm going to have 1,000 points for my 2020 reward. So I know it's not fair. I knew the program. I got it done in 2 months. But that's my point. It's not about fair or not fair. I got it done in 2 months. So health should not be something that's treated like a one and done. I promise you, I'm still going to do step challenges. I'm still going to compete with Sandy to see how much over 1,000 I can get, because some of us are really competitive. There's nothing that says you can't earn more than Sandy. You know that you're going over 1,000. We're going to race to 1,500. I feel it. So for some of us, we want to do it because we want to do step challenges. I've had questions like, what if I earn 1,500 points this year? Can't 500 points roll over? Not the way that it works. These are not cell phone data, gigabytes here. You can't roll them over and use them next year. Health is not a one and done. It's a constant conversation between you and your healthcare provider. So even if you think I'm going to be the superstar this year and I'm going to try to get all 2,100 points, and then won't I be done for the next year? No. You've got to wait till the next reward cycle and start again. Because again, it's about annual preventative health. It's not just about how many points can I get. So this planning for success is just that. Remember that it's designed to be a 12-month program. You do need to plan. We do right now, if anyone's participating in the step challenge, Colette knows that I've made comments about how much she is stepping because I can see we're on this little board. I can't keep up with her. I'm going to go to Zumba with her one day and get steps. Now, some people might say, oh, I don't want that data out there. Raynell is going to talk about how social you have to be or don't have to be with this. But most of us know that when we do have a strong social network or support group for our health and wellness, we tend to do better. I tend to go for my 10-minute walk when my colleague says, let's get up and go for a walk. Or if you're drinking water, you know, if I'm doing it on my own, I might not pay attention, but the minute my neighbor next door says, have you drank your water today? I'm like, oh no, I haven't, I need to get going. So this is meant, you know, we do want to think about the social support network. You do want to, plan for these health cards. I was out at Oviedo in July and someone said, I got so excited, I added 10 programs to my Cafe Well account. And we're like, those expire. Because if you don't get them done by the program expiration date, you can't do them. So again, if you're some of those people that you're like, I'm a go-getter, I'm getting this done, don't put 10 on unless you have time to do 10. Right now, at any given point, I find that I'm doing about 4 cards at once, and that's enough for me. If you are someone that you just want to get it done, then add it. But know that if you don't get it done in time, you either have to leave the program, as Raynell will show you, or you're going to miss the opportunity. There was a question. Here. Raynell, I'm going to wrap up on these slides and turn it over to Raynell, and I'm going to let her show you how to do that. So what I have been doing in terms of the map out when you complete, we were talking to the consultants, and part of the reason why you have that folded brochure, if you look on the right side, there's a 12-month calendar on that. And so you may map out. If you're in student affairs, you know, you may not be able to leave your desk in August because we want to make sure students are in the seats. August might not be your time to, you know, engage in a lot of extra activity because you go home tired. But if you're someone like me, December, once I'm done grading, I may have more time to do 2 or 3 well cards. So based on whatever you do during your work day, when you're ready to do this on your personal time, you want to make sure you have time to do it. So don't plan to do something that you know you're in your busy season, if that makes sense. So we did ask the consultants, and Kathleen quickly obliged and made a 12-month kind of planner. The other thing that I've been doing is I'll put reminders in my phone, like, okay, I need to go log for this particular chapter, and that way I don't forget. So there are some quick tips. Again, Raynell will show you with the well cards, there's always a makeup. It's sort of like a do-over. If you forget, like in my 4-week program, if I forgot to log something, I could wait till chapter 5, which was a 3-day grace period, and go back and track what I forgot to do. So you'll see this in a bit. The calendar again, looking at this is a suggested activity. Some of you may in September, your flu shot has to be done on campus for the 100 points, so that has to be done in September. So I'm competing with those guys. So what we're doing is, this is just a sample, but flu shot is one that needs to be in September. Step challenges are fixed. The first one started September 4th and will end October 2nd, I believe. The second one will run February 2nd to March 2nd. So those are fixed. If you want to participate, you've got to save those. In December, you know, I might want to do the cut the sugar card just because I like Christmas cookies. So maybe I want to be mindful about how many cookies I'm doing. Maybe I don't want to do cut the sugar, so I choose something else. The step challenge has already started. It's not too late to add it on. So if you want to participate, you can. You're going to walk around the world. And again, I'll let Raynell show you that, but she can walk you through. My second to last slide is think about what your why is. On that 2-page folded handout, we left a bubble cloud for you to think about your why. Your why might be you want the $50 because that stacks up to $600 over the year, and that's fine. Your why might be better health. It might be the young family. I think it's always important to have the why because it keeps you motivated. And last but not least, in terms of where do we go for help, if it's about setting up your Quest account, this is the number for the Health and Wellness Service Center. If it's about the Better Use Strides, you can email or call, or you can always reach out to one of our HR benefit team members and they'll work to get your question answered. In terms of questions, I'm going to hold off on questions because we're good on time. We have 35 minutes, so Raynell can have at least 20 minutes to go over her program. This is a first. Like, I don't know how we did this. So we'll give her time to go over the program, and then I'll come back up and join her, and we'll take all of the questions that you might have remaining afterwards.
Well, while we wait for that, can everyone hear me pretty well back there? Well, my name is Renelle Fields, and I work for Florida Blue in the Better You Health Promotion Program, and I work directly with Denise and her team, and I am here to walk through the actual site. So to let you know what you'll see once you log into the website. Has anyone logged in thus far? I know if people say they complete a few activities. So a few people have logged in. I know you've logged in. You're the expert now. Okay. Well, great. Well, we'll walk through here, and then which one? I can't see the bottom of this. Which one was skip one? Do you remember which one?
There.
This one?
Yeah.
Okay. Okay. Oh, let's see, I'll just have to. As soon as I get logged me out. I think it was the other one. It is W12. I know this just worked. Okay, I can't see the bob. Can you? Is this where we can? Oh.
If you use the down arrow.
Oh, okay. Just scroll down. Okay. There we go. Let's see. It's different. Okay. All right. So now we're into the site. So for those who have not logged in, I would recommend for the first time, when you log in, that you go to your profile and set up your profile. And so here under your profile and settings, it's right there. You'll see like your username, whatever your username is. Here is where, let me see if I can make this bigger. Here's where you can actually, you can add a picture for your username. You can change your username. You can also edit like some information regarding about, a little bit of information about yourself, or you can add information about your dependents. So for example here, if you want to add information about yourself, this, people can actually see it if you want to, and I'll show you how you can make that preference. You can add, I don't know, my name is Joe and I love gardening or whatever. You can add that information there, and then you can also decide who can see your information, whether it's just you, your friends, or everyone. And that's everyone that's in the Cafe Well network, and that's from, all plans. And I'll show you kind of what the friends is and what that means. And then just other information if you want to add about your work or your dependents and your health interests. And so the reason why this information is here, because it's set up like a profile similar to like Facebook. So once I show you how you can connect with other people, you can decide if they'll see your name, your username, information about your family, your health interests, etc. So I'll show you where you can actually do that. Also in your settings, you can also go in and change you update your username, your security questions, just some basic information. Just wanted to show you where that is, and check your account status. Under communication preferences, this is still under the profile settings. This is where you can actually go in and decide how you want to be notified or how often. So like if you want to receive emails from Cafe Well or a newsletter or updates, or if you want to receive an email once your biometric results are in, you can actually decide what information you want to receive. You know, live webinars, updates, and if we go down here to the bottom, there's an option for biometric data. And so I'm going to click on here, and so once your biometric data is received by Cafe Well, you would actually get an email, and so you can log in, and I can show you later where you can actually see your biometric results, and they'll store there from year to year. If you participated in the past, in our biometric screenings in the past, the health screenings, you'll see your results in there from the past few years. So you can actually log in and see those results if you participated in the past few years. Under connected devices, this is where, you know, as you are having your step challenge now, Race Around the World, this is where you can connect your device, whether it's through MyFitness, Fitbit, Jawbone. There are a lot of instructions. I know that there's posted on the site. I think me kind of talking through that will probably take another hour, but just wanted to let you know where that is, where you can connect your device. You can also connect it when you sign up for the step challenge, and I'll show you where you can see your actual step challenge. And then privacy centers is just let you know that they're protecting your information for privacy. Okay, and then under messages, you may, once you connect with a friend, and I'll show you how to do that, or if you send a message to a health coach, because there's online health coaches that can answer questions about the platform, about resources. They'll send you messages here, and you'll get messages from your friends here, and so you'll get a notification there. And then here's just where you'll get notifications, like, you know, if your results are in for your biometric screen or any type of notification. Connection. So this is what I was talking about earlier, the kind of social media component of the site. You can actually search for people in the actual site by first name, last name, or if you know their username, and you can connect with them. You can also invite people outside of the platform, and I really like this because I actually tried it myself. So say, for instance, you have a sister who's not a Florida Blue member, who's not with a college, however she supports you, you all walk, you know, support each other regarding your wellness. You can invite her to be your friend. You'll send in her, put in her email and type a message, and she'll get an email from Cafe Well to set up an account. The only difference is that when she sets up with that account, she won't have access to the same incentive program that you have. She'll have just some basic resources where she can access, you know, health information and support you, but it just gives her the ability to connect with you, but she will not have access to the same incentive program that you have. She or he, whoever you connect to. Okay. I think it's on. Okay, maybe I need to move it closer to mine. Is that a little bit better? Seems like it. Is that better? Okay. All right. Right. So that's under connections. And of course, if you have questions, of course, reach out, as Tracy gave all the contacts if you have questions. If you want to try to navigate through questions yourself, there are frequently asked questions here actually on the site that you can reference as well. So that's all of the kind of basic administrative things that just wanted to direct you to, and you know, to set up once you log in. And so once you set up your profile, you can go to homepage, and what you'll see is some rotating messages, and we call them jumbotrons, but I just call them large messages. And so you'll see just different messages rotating out throughout the year on different topics regarding knowing your numbers, getting your flu shot, earning your rewards. Right now, your Race Around the World step challenge is going on. So once you have some major type of activities going on, you'll see that at the top. When you first log in, I recommend that you go to learn more or learn how the site works. if you're needing some additional support on how to navigate through the site, this particular message will give you a tutorial that you can actually, it walks you through how to utilize the site and how to add a well card. And so that'll always be available throughout the program. So it just gives you a step-by-step on how to, engage into the program. And so that'll be right there at the top. Another one that that you can actually look into, another message, especially if you're just starting, is the earn rewards. So if you want to if you don't have your handy sheet, your success sheet available, you can actually click on earn rewards, and it just provides you more details about your wellness program, just on a high level overview, just to engaging you on what activities you can engage in, and also how to get to your rewards dashboard. And then there's some additional just details here at the bottom of the site. So those are all of the rotating messages. Of course, they'll be rotating out throughout the year. You'll also see some messages on the right-hand side. We call these right side promos. One of the programs that you have that you can actually earn points for if you do qualify is the diabetes prevention program. If you qualify for that, you'll see that message here on the right side of the page, and you can just click on it and it'll direct you to some additional details about the program. Right, and so all right, so now we're going to kind of go to the personal health itinerary. Tracy was talking a little bit earlier about the well cards and different types of well cards, how to add them, etc. And so all of your well cards are housed in your personal health itinerary, and I just see the personal health itinerary as like this holding station with all of these programs that is recommended to you based on the results of your health assessment, your biometric screening, and then other activities that is built into your wellness program. And so you'll see them here. And so what you'll see is active programs, and these are programs that you've already enrolled in, and I'll show you how to add a program. Previous programs, these are programs that you've already completed, so you can always go back and see what you've completed. And then add programs, these are programs that are waiting to be added for you to participate in. One thing to note, when you log in for the first time and you haven't completed your biometric screening or your health assessment, you will not see a lot of these, what we call well cards or well programs. You may only see a few, but you'll see more as you complete your biometric screening, your health assessment, and you'll also see like your step challenge if you have one. Of course, you have one going on this time. You can see here's the step challenge. And so Tracy was talking a little bit earlier about the different types of well cards. And so kind of going back to what you can earn points for, we have the Healthy Living well cards. These are the programs that take longer. They're orange, and you can earn 50 points for those. And so you'll see that label Healthy Living. And then we also have the Healthy Habit, and those are the little shorter ones. They take less time. Those are worth 25 points, and you'll see those there. You'll also see cards that that are not blue or orange, but you can earn points for. Like, for example, your Next Steps coaching program. This is a coaching program where you can work with a nurse. If you complete 3 sessions, you can get 100 points. So although it's not blue or orange, you can still earn points for that. So you just got to pay attention to which one of the cards are there. Also, after you complete your biometric screening, if your results are not in line with whatever the recommendations are, like for blood pressure example, like I had to complete the blood pressure one, you will see that blood pressure or BMI or healthy weight or card in here about a few weeks after you complete your biometric screening. So just pay attention to that and look at the title on your actual sheet, so you'll know which ones that you can actually earn points for. Okay, I'm going to go back in. I'm going to show you all how to actually add a program. And we'll start with the health assessment. As you can see, this one's not blue or orange. However, you can earn points for it. So, to click on it, you can learn more. And then you would just simply join. And once you join, you'll click get started, and it will move from, as you can see here at the top, I'm just trying to move up here. It will move from your ad programs. Just trying to move up here. It'll move from your ad programs to your active programs. So it moved over. So this is the program you've signed up for. And to basically, to complete your health assessment, you would just, you know, click on complete assessment. And of course, it'll ask you a lot of questions. Very intuitive. So based on what type of responses you answer, you may get a different question. And as Tracy said, you'll get a report at the end. And so just wanted to show you what that looks like. Of course, this is in a different language. And I don't even know what it is. Does anyone know? But this is a different language. Maybe I accidentally clicked on something else, but pretty simple to complete. Again, in the past, we'd have to bubble in everything, so you don't have to do that at all. You can complete it from your desktop or from your mobile device. I wanted to show you another one because Tracy was talking about well cards and paying attention to when they end and how to, you know, basically, you know, remove yourself from a well card if you feel like you can't get it done in time. So here's an example. So here is, oh, just clicked on something else. Okay. Here is a healthy living well card. And as you could see, there are there are 5 chapters. So there's actually 5 chapters. So there's 5 different opportunities where you would have a week you'll focus on this topic, you'll focus on this topic the following week, and this all falls under men's health. And so one thing to note is that you may watch a video, you may read some content, you may track a behavior, like for example here, you know, you're tracking how often you floss for fresh breath for a few days, but you need to track when they actually end. For each week, because if you don't, then it's considered to be incomplete, and you know, you won't get the points for it. So just pay attention to that. I know when I completed them, I basically tagged my calendar on my phone when I had ones that just make sure I would log in and just complete the activities. Just be aware of that. Sure.
Since Ken knew that I would add, the don't miss out. Will you go back to the chapters? Don't be stressed. We'll make you do the program on stress. So if you look at the 5th one, don't miss out, that may be a week, that may be 3 days, depending on the program. But during that one, you can go back in and fill out what you missed. And I have done that, and you still get your points. But once that chapter expires, then you won't be able to make it up. But there have always been a don't miss out chapter to every program that I've completed so far. So that's where I tell folks, if you forget, that's really what you want to mark in your calendar, so then you can make it up.
Yeah.
Or the other thing, like with the floss, if you have to floss 3 times, what I might do is day 1, day 2, just note it in my head, and then on day 3, go in and report all 3 at once. So then you don't necessarily have to log in on a daily basis. So there are ways in which if you're a person who you're like, I don't want to be tethered to a computer, I'm at my computer all day long, Eric, I'm calling on you, then you might just want to go in once after the 3rd day and put all 3 in.
Yes, you can do that as well too. And the don't miss out was actually recently added because of challenges we had with people not having a chance to complete. So yes, that really, yep, that's a good point there. But they're pretty easy. I mean, they're pretty easy to complete. So definitely wouldn't want you to get stressed out with the wellness program about completing a well card. Let's see.
So
Make sure.
Question about expiring. You're going to show us how to
Yes. Yes, I'm going to show you. So about how to. So one thing you want to know is that you can only remove yourself from a program once it's inactive. Once it moves from active and it's gone, it's gone, you can't go back and add it. So you want to, like, if you get into this program, you're like in the 2nd week or something, you're like, you know, I don't think I'm going to get it done, and you want to go ahead and remove yourself and have it go back to your ad programs, you'll click on detail, and then you'll click on leave program, and then it'll go back Just waiting for it to filter back. It'll go back. It's actually paused. I don't know what's going on. It should go back. Looks like it'll actually go back to your ad programs. I don't know if it's taking a little bit of time, but it'll move back here and you'll see it added back to your ad programs. You just can't add it once it's gone. Once it's expired and it's just like gone, you can't add it. But it'll filter back in, but you don't have any control over adding it. Absolutely. Yes. Oh, I want to also show you the rewards page as well too. I just wanted to show them the rewards page. That's probably most important. This is where you can actually see your points. You would go to rewards. Oh, did I just click out or something? Oh, you go to rewards, and this is where you can see all of your activities, and these are the biometric measures, and your results will be listed there, and as well as your status and also your screening date. And these are all of the activities you have within your wellness program, and you can actually click on that activity and click on detail to learn more about that activity. So you can actually track your points, throughout the program, and you can also pull reports as well too.
Add, if you have to do the reasonable alternatives on the dashboard, if you scroll down, like the BMI, when you click down on that, you're going to see the 4 weeks to a healthier you, and you can click on that hyperlink and it'll take you to the ad program. So if you are feeling overwhelmed and you're like, I don't know what program I'm supposed to add, the dashboard tells you what the alternative is. So don't stress about that. I think once people get into the program and start just playing around, you'll start to find out what questions you still have, and then you'll find answers to questions you may have right now. But so far, knock on, I don't think these are real wood, but I'm going to knock on wood. So far, it's been pretty straightforward on using the platform.
Yeah, I agree. Yep. So, and again, you can access it from your mobile device as well, just seeing if I didn't. And also, I know we talked about just questions, but again, Teresa had mentioned this earlier, but there's the contact information as well. Say, for instance, you're like, my points haven't loaded. I completed this program and it's supposed to, load, a week ago. You can actually, contact them. You can call or email as well too, and they can log into your account and help you with that.
We have about 14 minutes left for questions, and so I'm gonna state one question and then I'll come to you, Eileen. We've had questions to HR about some folks don't use our insurance plan. Some people say, well, why? But if you're on Medicare, you wouldn't necessarily need our insurance plan, or if you've got military benefits, you wouldn't necessarily take our plan. If you're not on a Florida Blue benefits plan, then you're not going to have the ability to participate in wellness. So those have been questions that we've been getting. So if you're one of the 30 some odd employees who opt out of insurance, then you're not going to have a chance to participate in this 1,000 point system. Although you could have someone email you an invite if you want the social aspect of it, so you could do that. If your spouse wants to participate in the social aspect, we did not make the wellness program applicable to spouses who might be on our insurance. But if you want that as an option, you can invite. I can tell Kim is going to invite her spouse like right away. I feel like Mark's going to get the email. So if you're someone who wants that support, but if you're someone who opts out of the insurance, then you're not going to have the ability to earn the 1,000 points. Eileen, what was your question?
I have two, actually. One, if I understood you correctly, if my sugar is within the range, right, my glucose, does that mean I won't get points if I do the Cut Your Sugar program, or I can't do the Cut Your Sugar program? Just for like, do I have to be out of range in order to get points for doing a Cut Your Sugar program?
It depends on what you report on your health assessment. So you may get a lightened down version if you're in need of focusing on sugar based on what you report. So you may get a someone similar to that. It's just based on what you report on your health assessment. So of course, if your glucose is in healthy range, you will not automatically get it as a reasonable alternative. However, if you reported like some nutrition challenges with you eating more sugar than expected, then you may get a lightened version of that program.
So it's Cut the Sugar isn't necessarily the best example because I had participated in Cut the Sugar as a blue card before the biometric screening was done. And so because my glucose was slightly out of range, I felt the same thing. I went to the doctor, it's fine. But instead of getting the blue card points for it, I got the 100 points for the reasonable alternative. But something like the 4 weeks to healthy living, which is the reasonable alternative to the BMI, that one's not a blue or orange card. So because it's not a blue or orange card, you're not going to get the points just because you want to do that. But if you happen to be out of range, then that one would get you 100 points. So it's a harder question to answer because it depends on if the program is automatically part of healthy living or healthy.
Correct, yeah.
My question is, for the challenges, the step challenges, I downloaded my Walk Fitness app, but it only tracks the steps when I turn on the app. So I've already lost 1,100 steps today in the challenge because it's not tracking, let's say, the health app on my iPhone, which tracks every single step I take. It's only tracking when I can't have that app running on my phone all day.
So no, you'll lose your battery. I haven't found a great alternative to the iPhone. I know Amy Stewart in eLearning has found a bridge for Android users. So there are apps that you can buy that'll convert your steps, like for example with your phone or with the watch, will convert it to Fitbit steps, and then that'll automatically load. I don't, for the iPhone, this is where we're kind of just testing it out. Right now, you can still manually record your steps through the app.
There's not a lot.
You cannot self-report. I've tried.
So I wonder why. Okay.
Because I've gone in and it did a great
So again, let me get everyone's attention so everyone can hear this. Because this was a great debate about, let me get everyone's attention. This was a great debate about, do we allow self-reporting activities or not? And so, you know, in long discussions on committees and consultants' recommendations, we said no self-reporting activities. And then what happened for the trial run of the step challenge, the 2 weeks before, we had the ability to self-report. And then I wrote saying, wait a minute, I thought we weren't going to have this. So there, through the app on the phone, right now you can still self-report.
I don't think it shows it here.
So I think that this is one of those moments where I would advise, if you're at home, rather than getting frustrated, you either send an email to the HR team or send an email to the Better Use Strides at floridablue.com and ask the question to get the answer. I think one thing that I can say that I've been very proud of, you know, being on employee benefits and working with the HR team, is that we have had a lot of conversations about equity and making sure everyone can participate who wants to participate. And so with issues like this come up, just reach out, and HR has been really great about giving a quick response to folks. And again, as we advocate for listening sessions, so the Employee Benefits Committee can kind of say, this is what we're hearing from our constituents. We can take that back to Raynell and one of her team members, Stephanie, as well as to our consultants. Other questions?
Yeah, we're having issues like connecting Connect My Fitness to the app, to the
You know, this is where I feel like a failure. Normally, I'm really good at syncing these things, and I have sent emails to her boss saying, I don't understand how this syncs, and that's part of the reason why the self-report is still there. This is where, for folks like Amy who found a fix for Android, she's willing to share what that fix is. For those of us who haven't found one, say for iPhone users, I would use the self-report and then let some ducks get in a row by the February meeting. And it may be that we need to self-report for February because, again, for those of us who want to do step challenges, we shouldn't be locked out of that opportunity.
And also there was a syncing
There was an issue with it.
to about 7 p.m. yesterday. After 7 p.m. yesterday, everything should be synced in right. So if you try it before 7 p.m. yesterday, just try again today. They should be synced.
When I try to connect, I get a oops.
Yeah.
Yeah. Get a oops screen. It doesn't allow me to lock that. So
Okay. I think, Renelle, I think we're going to have to email you and Stephanie.
Yeah.
I think it's the Signal because I have it. If I stepped outside, which I've had to do several times, I don't have the Signal.
Well, I think that this is important that, you know, if you're on a phone, it's really easy to take a screenshot and email it to Denise or Lynette or Olga. I'm going to give everyone your team members' names, and then we can send it forward to Florida Blue.
Because I'm going to say, do not expect that we know how to operate all your devices, because we're not trained on
Right, that's why I'm
devices.
just wondering who we reach out to.
I would say Cafe as well.
Mhm.
But give it a try today. Do everything you did before. Try it again today when you have good signal. And see if your apps are syncing. And also go outside of Cafe Web and make sure that your apps are syncing there. Then come back into Cafe Web and see if there's some stuff with them. I did it several times this morning and everything works fine on my end. But I have a Fitbit. I don't have my own Fitbit.
I had to log into the My Fitness and authorize through there.
To share the data back.
You know,
From both sides.
That's where I'm getting used to.
I had, you know, and this is, I have done Weight Watchers in the past, and I have had no problem syncing Apple Watches or Fitbits or Jawbones to a Weight Watchers app. So I'm not the right person to ask because for whatever reason, I haven't been able to sync to this platform. So again, part of the reason to email, it's not to expect a quick email back from HR, but it's to report the problem, because if 20% of our employees are having the problem, then we need to revisit this. Whether that means always leaving it self-reporting, or whether that means finding another alternative to a step challenge for 100 points, because this platform is customizable. And our committee sat down and we talked to the consultants and we said, what do other corporations and places of higher ed do? And got the answer, and we left the step challenge in. But it doesn't mean that we have to do an auto log step challenge year after year after year. So that's where the feedback is really important. And so give it, positively or negatively. And just recognize the fact that for those of us that are on the committee or those of us who are in HR, we might not give an instant answer back, but if we don't know there's a problem, we can't address it for future iterations of the program. Other questions, Maggie?
You're having sessions at convocation. Are those similar to what we had heard today, or do they have different content? And if it's different, are you going to have other opportunities where you can't go to convocation sessions? Are there going to be other opportunities?
Okay, so the convocation sessions that are coming up September 25th are not health and wellness. I have to emphasize that. They're not health and wellness. They are employee benefit plans for the 2019 year. And I highly suggest that you attend one of those 3 sessions that are being offered. If for some reason maybe you're presenting during all 3 of those sessions, then talk to the HR team. Do we have plans to record at least one of the sessions?
Unfortunately, we can't.
Okay, so we won't be able to record one of the sessions, but what we have been working with, and Kathy knows that we're tired, we've got this beautiful benefits guide. It's about a 34-page guide that her team, Denise's team, and then I, as chair of the committee, got invited. I guess I got lucky to sit in on these briefs. It's the first time Seminole State has produced a comprehensive guide to benefits. So you'll see what the offerings are for medical plans, for dental, for vision, for short-term and long-term disability. It is a beautiful document. I've got to finish reading the final proof. I got it in my email, Kathy. I did a quick glance at it, and it's beautiful. So you will have all of that information in one place. But what Kathy and her team will do, along with Denise's team at Convocation, is we have a PowerPoint presentation set up based on that benefits guidebook to walk you through what decisions are going to be right for you for the 2019 year. The 2019 year, the committee decided that in order to keep the high level of benefits that we have, we thought it would be better to have some employee cost share instead of seeing a change in our benefits. So what you'll learn about at that program is if you're on the HMO plan as currently offered, there's going to be a $70 cost share, meaning that you'll pay $70 of the premium. For those folks who participate in wellness, your $50 reward is going to offset that $70. So you're really only going to have a net of $20. For For those folks on the PPO, again, we like the $500 deductible. We like the max out of pocket at $5,000. We said it was better. We were better off to have employees pay $50 a month than to see a change in benefits. So we didn't want a max out of pocket to go up to $600. We didn't want max out of pockets to go up to $16,000 and $18,000. So we said it would be better to cost share and then to use the wellness program to help offset those costs. So if you're on our current PPO plan, if you participate in wellness, your life doesn't change. You're going to have a $50 line for pay in your paycheck. You're going to have a $50 deduction for your insurance. It's going to net out to zero. If you choose our new HMO plan, which will have a little bit more out-of-pocket cost to you, you're going to see that you're going to have a net reward of $20 because again, you're going to earn the 30, or sorry, you're going to earn the 50. You're going to pay the 30 net of 20, and then if you go on our new HSA plan, there is no cost share to that because HSAs are set up differently. You'll learn about those from Kathy and her team, and so if you participate in wellness on the HSA, you have a net reward of $50. So yes, those sessions are going to talk about our health and wellness program in terms of offsetting those employee cost shares, but what they're really going to do is go over the benefit mix and hopefully give you tools that you need to pick the right plan for your situation, whether that's just you or you and a family member or a full family. Denise.
In addition to the 3 sessions on the options for health plan, we'll have 2 sessions dedicated to only the HSA plans. So if you're able to catch a session on all the plans and a session on the HSA plans, so you get information from both.
And there will be some folks who already know they don't want an HSA, so they don't need to go to that one. But for folks who go, I'm not sure how an HSA works, or I've heard good things about it, you may want to go and learn how that works. And then there are additional learning opportunities on the HSA through online videos. But for the benefits overview, we are strongly encouraging everyone to attend one of the benefit sessions during convocation. But again, if your job at convocation takes you away from the ability to attend sessions, then you will get a benefits guidebook, and it really is a beautiful document. So, Les, I can't help it. It has tons of color. You're gonna hate it, but it does lay everything. Oh, he's like, I don't hate color. It has to do with the fact that Les was once in a training and he says, you know, you like color more than you think everyone else likes color. I'm talking about syllabi. So I pick on Les for colors, so I'll stop now because now this is recorded. So anyway, but yeah, so you'll have that to walk you and your family through what your situation is. Other questions? It just came down to what we were going to include for points. It's my understanding that we could offer more if we wanted to do one a season, but really we have 2 seasons in Florida, super hot and not as hot, so we just had 2 for the first year. We may look at putting in a 3rd or 4th, but that really depends on feedback that we get from you. Any other pressing questions? Again, just because the training is over does not mean you can't ask questions. Email Denise. Look for this beautiful benefits guide that I keep talking about. Thank you for attending and have a great afternoon.
I was going to ask you.
Oh, and I'm still in there.
No, yeah, I have another meeting I've got to run to. Oh, you're there. The card colors. Can you show me a card? Because I am not the.
I remember you